Introduce our speaker, I have a few business announcements to make. This CME activity is sponsored by the Hawaii Consortium for Continuing Medical Education, which is a joint venture between the Hawaii Medical Association and the John A. Burns School of Medicine, University of Hawaii. At this time, could you please enter the name and credentials of everyone viewing the grand rounds for CME attendance purposes? Could you please enter that into the chat box? As a reminder, evaluations are required for CMEs. You can find evaluations by following the link in the chat or at any time on our website and email advertisement. Your comments are very important to the planning committee and will be used to plan for future programs. As you know, all sponsors of CME are required to execute a conflict of interest policy. Dr. Pascua has disclosed that he has no relationship with commercial supporters that could be a conflict of interest. It's my great pleasure to introduce our speaker. Dr. Pascua was born and raised in Wahiawa. He graduated from Mililani High School, then went for undergrad to the University of Hawaii. He has a master's in child development from Columbia University and worked as a child development specialist in New York City Methadone Clinic. He returned to Hawaii to attend JABSOM and then completed his pediatrics residency at Kapiolani. He was the former chief of staff at Wahiawa General Hospital and has been at his current practice in Wahiawa since 1996. His interests are cooking, church music, and reading. For him, going to a used book sale is a contact sport. Thank you for that lovely introduction, Dr. Pascua, and welcome. Today, Dr. Pascua's talk is entitled, Can We Talk? Resilience in the Time of COVID, the provider as patient and the patient as provider. Thank you so much, Dr. Pascua.
Thank you very much. Can you guys hear me? Just want to make sure you guys can.
Yes, we can hear very well. Thank you.
Perfect. Okay, perfect. Okay. All right. So every time I'm asked to talk to a group about my experiences with COVID, I find that the target kind of changes because things change are happening very, very quickly in society with regarding COVID. There's a lot of uncertainty. So I guess when I'm looking at this now is a person who has gone through the COVID experience, looking at other individuals who may be going into the COVID whitewater for the first time, with the understanding that with regard to reinfection, I'm also looking at the possibility that I may become reinfected as well, and having to go through the whitewater again. Having anticipated the problem of that going, how am I preparing myself to this, and then what can I possibly tell you folks or other people who may be going through this or about to go through this unbeknownst to them? So the first thing is, can we talk? Resilience in the time of COVID, the provider, that was me, became a patient, and now the patient, that was me, now comes back to being a provider. Next slide, please. Okay, this is in a nutshell what happened to me. So on March 12th, I go to New Jersey to attend my daughter's engagement party. And at this point, I was already becoming aware of some very, very bad things that COVID was doing to elder care facilities in New Jersey. There was one where I think there were 15 casualties in one elderly home, and immediately I thought, wait, this is crazy. And then some other things were starting to show up on the media, and there was a hint that this thing is COVID is just kind of starting to engulf in a horrible way. And then next thing I know, for the East Coast, of course, Broadway closes on March 18th. Closing of Broadway, that's impossible. And then on March 22nd, I'm returning back to Hawaii. I'm starting to feel bad on the plane. I have a loss of sense of taste and smell, and I'm having a hard time breathing. 3 days later, the respiratory distress kind of continues. Not distress, but feeling of short breathness occurs, and then the CMO calls me and tells me that I went to get COVID tested, and now tells me that I'm COVID positive. And he asked me, "Hey, how are you feeling?" I told him I'm 84% on room air. He said, "You got to come to the ICU right now. Got to come to the ER right now." So I did. 2 days later, I'm sitting in the ventilator. I'm ventilated and intubated for 10 days. And during that time, if you've ever been intubated and ventilated, or even going under, it's not like you close your eyes and then you wake up 10 days later or however long, you say, "Oh, what did I miss?" You go in and out of consciousness. And it is some of those insights that I want to kind of bring back to you now. So I was on the ventilator there for 10 days, and at which point I had some sort of epiphany. And I will tell that to you when we get to point number 10 of something that I'm going to share with you later on. Then I ended up on the respiratory ICU weeks for 2 weeks, respiratory wards for 2 weeks. The staff is coming in very, very competent. Props to Queens Respiratory ICU. Oh my goodness. But for 2 weeks, you're in there by a room by yourself. Your family cannot visit you. And everybody that comes in is in full PPE. So much for human touch. I'm at some point deemed okay enough to discharge to home, which meant that my criteria was being able to walk 10 feet and my SATs would not drop below 92%. But it was still very short. It was very, very short breath. And then before I went home, swabbed my nose, COVID negative before I left, because they wanted to know if I needed to quarantine myself. And then after that, I'm at home on temporary disability for 3 weeks, trying to gain back my strength and also my ability to think, get back to that later. And then I needed to get neurocognitive clearance, right? Because what happens is that when you are intubated, and you are undergoing a chemical loss of consciousness, the gravity of thinking is removed from your brain. Okay, so imagine an astronaut goes to the moon, has no gravity, and then they walk around for 10 days without gravity. Now they return on land. With Earth gravity, they cannot move. Same thing if you remove the ability to think for 10 days. So it took me a while to kind of get started again. My brain started to get started, and then I could return to work after being COVID negative tested for the second COVID test in which I could be cleared to go and see live patients. Next slide, please. That is what happened to me. Now we're going to talk about what happened to my family. My entire family, they all tested positive. Some had minimal symptoms, and meanwhile, I'm intubated in the hospital. So you can imagine, my family's imagining, is what happened to me going to happen to them? Okay? And it's the same thing that I have, that feeling that I get whenever I hear about 100 and something new cases, and I'm thinking, are they headed in the same direction? Okay. When I hear the amount of new hospitalizations, I'm thinking, are they about to go through their first their first COVID whitewater that I've just gone through, that I went through? My wife was receiving receiving daily updates of even the smallest improvement. And that I would say is the masterful move for the ICU. They would call every day, okay, every day. And every little bit of improvement was something that my wife could live with for that day. My family is a very functional and cohesive group, so they held themselves together. And then from the outside, recipients of lots of social report, far and wide. Anybody who seemed to find out was writing my wife. We had friends come by, the minister called us every day. The only time in which there was a little bit of a kink in the process was when the clinical personnel had to bring up the topic of DNR to my wife. And that is when she just kind of said, okay, you know what, we were good talking for a while, but I'm not ready to talk about that right now. And much of their credit, they kind of backed off of it. That's what happened to my family. I don't want that to happen to anybody's family. Next slide, please. Now we can talk about what happened to me, what happened to my family, what happened to my clinic now. COVID disrupted our operations. There was a cluster case. We had to close the clinic. We had to reopen it. It was a mess. 2 members of our clinic lost family members due to COVID. And then here I am, one of the providers is on a vent, and now we're a highly cohesive staff, which is basically used to just hanging out together, and we're a close family. We now find ourselves unable to congregate. So COVID, yes, as we know, does have some big, big disruptive effects on everything. That's what happened to me. That's what happened to my family. That's what happened to my clinic. Now, what is happening to everybody? Next slide, please. What's happening to all of us on a pandemic scale? Disruption of operations. We've kind of got a siege mentality kind of going on. There's an information conflict. There's some dystopian lifestyles that we're leading here. There's some financial consequences. Some political viewpoints are kind of going back and forth. Biological uncertainty, and this is global. So in a way, we are all going through a cognitive whitewater at this point. Now we see numbers that say, okay, the numbers are decreasing. That's awesome. That's awesome. Okay. But that's also because maybe we're testing less people. Okay. But even though the numbers are going down, what sacrifices have we been made? Have we had to make? I see some live pictures right now, and I see pictures people wearing masks. Okay. How long are we going to do this? Schools are closed. There is definitely a claustrophobic mentality that's happening over here. So next slide. So, we would see something like this. Coping strategies for HCPs during COVID. Okay, makes relative sense. Look on the do side on the left. Positive thinking, balanced diet, regular exercise routine, taking a break from routine work life. You know what? That's tips for positive health thinking anytime. Okay, so anytime. Now look on the don't side. No substance abuse, excessive online activity, no partying, travel, no believing fake news. That's also kind of how to keep your mind together. But that seems, I have no argument with that. That looks pretty good, okay? But I still think it's kind of generic. Next slide. So that's why I'm going to be giving you some pointers, I guess. So the first thing is for all of my fellow colleagues, get good at what you do, and then trust each other to really, really deliver. When I was inpatient and I was in the ICU, and I knew that I was not a provider, I was the patient now. I remember looking at the pulmonologists and the ICU people and all the nurses and saying, dudes, I really, really trust you. And I know that you are going to deliver to try and pull me through this. I'm going to be water in your hands. Hey guys, whatever you guys want me to do. What do you want me to do? Okay. So provider is patient, patient is provider. And the last part I'm going to put over here is be not afraid. Next slide. Okay. So this is going to prepare your mind to take a licking but keep on ticking during COVID. Okay. Or if you are intubated, because we don't know how long this is kind of going on and there's just some pressure there. So how are we going to last? I'm hoping to fortify you as my colleagues, because you and we are going to need to keep our head together, whether or not you're intubated for COVID, but especially if you are, okay? Again, I'm going through this with the anticipation that it might happen to me again, and other people, it may not have happened to them yet, but my experience prompts me to trying to give some suggestions. Next slide. Okay, so about 5 years ago, before all of this, I love to read. I love to read. So going to a used book sale is a contact sport. So I found this book, Genius by Harold Bloom. He's a literary critic. And on the bottom it says a mosaic of 100 exemplary creative minds. Next slide. So what he did is that he took 100 literary geniuses and he just made a short little script as to what marks the genius of that what marks the genius of the literary person. Example, Shakespeare. He had a tendency to overthink himself, overhear himself. So he would say a word, he'd invent the word, and off we go. So a lot of the words that we have are made up by Shakespeare. That was his literary genius. In this book, there were 100 of them, okay? And so I really got into it. So here's the inside margin of the book, and I started to just kind of make some scribblings in there. Next slide. And then I started to write essays about each one of these statements. Next slide. And then I started to write it out. Okay, so what I'm saying is that starting from 5 years ago, this stuff was really in my head. Okay, my cognitive glove compartment was packed with this stuff. It was just kind of like a hobby. Next slide. Okay, the point being is that even during intubation and ventilation, you never, or even now, even beforehand, we never forget who we are. In intubation and ventilation, you never forget who you are. You come in and out of consciousness, and then in those semi-awake times, you remember you've got friends, you've got family, you've got people out there that are hoping for you, and now you're seeing some hallucinations and you're seeing some delusions, and you don't know how long this is going to last. And I'm thinking, oh man, what am I going to do with this? Okay, and I'm trying to orient myself. And I remember at one point when I had just gone down under for the first time, I remember trying to communicate with my family, and I'm trying to communicate with my son, and I'm telling him, son, if you can hear me, you're gonna get calls from a doctor. You got to ask him everything that scares you. Okay, you got that? Now go call your sister. His sister's 5 years older. She's now 25. I said, Nikki, you got to do the same thing. Okay, now you and your brother, you got to go take care of your mom. Okay. Now I call my wife and I go, honey, look, everything is going to be fine. Everything is going to be fine. And again, I'm trying to think of this in my early intubated state when I'm coming out and I'm semi-hallucinating or lucid. I'm still trying to think, because even in that state, you never forget who you are. And then I said, okay, so you take care of the kids. Meanwhile, don't worry about me. Dad's got some work to do in this intubated place, wherever I'm at this time. And then at that point, I had to decide whether to tell my family goodbye. And I decided, no, I'm not going to tell you guys goodbye. I'm going to see you guys. I'm going to say, see you later. If at any time I feel like I got to say goodbye, I'll call you guys back. Okay. But the other thing that would keep entering my mind, because it was so inculcated in there, were some of the things that I read in that book. There were 100 of them. And in retrospect, okay, I kept thinking about these things while I was in that state. And coming out the other end, in retrospect, there were some things that kept with me, even before. And here are the top, out of the 100, here are the 19 things that I remember trying to hold on to in my head and using in my head as I was trying to hold myself together during this journey. And there were things that I read before. So let's go through this. The top 19. Number 19, coming in from Montaigne. Acceptance of oneself as a human, albeit capable of profound self-knowledge. That is, all these suggestions that I'm going to tell you now, there's somewhat cerebral approaches to COVID for now to help us keep our act together. You can and should do these things because you are capable of profound self-knowledge. Okay. Next slide. Number 18, Tolstoy. What appears as universal is in fact, what appears strange is in fact universal. What appears universal is in fact strange. Take nothing for granted. We're all walking around wearing masks. Somewhere, this is considered normal, okay? Having an unstable type of, medical society or medical biological situation. In some places, this is considered normal, how it is every day, unfortunately. Shortage of possible medical care. In some place, it's happening every day. So somewhere, this is considered normal. So it's just looking at things in scale. Number 17, next slide. Profound deep reading. You guys got to get into this right now because that is an act of cognitive conditioning. Prolonged loss of consciousness is a state of cognitive deconditioning. So condition yourself now. Next slide, number 16. From Mohammed. Engage in audacious, imaginative originality of thought contrived in the immediate. That means even though you find yourself in an odd situation, keep thinking. Churchill, if you are going through hell, you keep going. In other words, do not resign yourself to the situation that says, oh my God, I'm in an unusual place and I'm panicked. It's going to last like this forever. That's when fear comes in. More about that later. Next slide, number 15. I like this one. This is my favorite. Visualize indestructibility of thought. Thinking need not be impeded by fear. This is relevant now at all social levels, from the intubated and ventilated individual to society at large. Thinking need not be impeded by fear. And your thinking is indestructible, even when you're intubated. Number 14, next slide. Beckett, perceive oneself as part of something unending. Exercise your genius even in negation, even in the void. So when you're seemingly unconscious and you cannot see anything or hear anything, and you're wondering, what am I going to do? I'm here by myself. Remember, you are part of something unending. You exercise that thought even if you find yourself in the void, seemingly alone. Number 13, next slide. From Frost. This is hard. Create poetry out of melancholy and nihilism. This is the true test of mental strength. In the face of fear and panic, it's almost impossible, but you got to try. You're sitting there going, oh man, what's going on here? What's going on here? What rhymes with here? Fear. Okay, I feel some fear and hopefully I'm going to get out. What rhymes with out? And you're trying to keep it, trying to think poetically in the midst of melancholy and nihilism. Number 12, next slide. Stevens, celebrate a cosmos built on entropy of death and to turn off all the lights and definitions and see in the dark. Imagine this mindset right now so that it doesn't take you by surprise. So as they were intubating me they rolled into my room at about midnight and they said, hey, Pascua, we're going to need to intubate you. And I said, I'm thinking, okay, I'm going to be a very good patient. I even hyperextended my neck to assist. And they said, never mind, Pascua, just relax. And then they went to the PICC line and then they put in the anesthetic. And as I felt myself fading, I thought, okay, this is where I have to try and see in the dark. And at that point, I thought, what can I do? What can I do? How can I contribute? All the ICU nurses and all those guys are doing what they can do. What can I do in this helpless state? I can just visualize. And that's what I did. I just visualized. And I thought, okay, coronavirus, let me visualize you. And I could visualize those little spike balls. And then I said, visualize. Okay, Leo, what do you got to bring? And I said, okay, I've got an immune system. What does that look like? And I imagine like these ninjas with their katana swords going after these spike balls. And I said, okay, that sounds pretty good. And then there were more spike balls and then more ninjas with their katanas. So I'm just sitting here in the dark, trying to see in the dark and make my own scene. And then at that point, as I found myself kind of fading, I had one last conversation with Corona. I said, you know what? I know what you're doing out there, but you know what? I'm intubated and ventilated. I'm going to be intubated and ventilated in a little while. And you are going to be on the clinician's turf right now. Because on my right, I've got a pulmonologist. On my left, I got an internal medicine person. I've got an infectious disease person over here. And they're going to put me in a ventilator. And these guys are going to take you apart with a blowtorch and a pair of pliers. And then that was my last mindset that I remember before actually things going dark. Number 11. Next slide. T.S. Eliot. Indulge again in a philosophy of your own. Get into some deep, profound reading and decide now what philosophies you are going to take with you so you can explore them. This is so that you can recognize yourself during and after psychic turbulence. During psychic turbulence. Decide now upon your level of determination towards recovery. As a medical student and having to deal with people or working with people or sending people over to rehab and physical therapy, I told myself many moons ago, Pascua, if you ever find yourself in a rehab situation, it's all going to be all you, okay? There will be no self-pity or whining or blaming the physical therapist because they're pushing you too hard. No, you're going to put on a gi, you're going to put on your karate pants, you're going to get your belt, and you're going to move towards your recovery. It's all you. Next slide. Number 10, getting down to the last 10 from Leo Party. Perceive every moment, even in the darkness, as an opportunity for epiphany. Like I said, you never forget who you are. And at one point, when I was drifting in and out, I remembered I have a family, I have a job, and oh, by the way, I'm the choir director for our church, and I'm supposed to sing a song for Easter. How does it song go? How does it song go? And I'm singing. Oh, and the chorus goes, da 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 da, be not afraid. And suddenly there's the epiphany. Be not afraid. And by the way, Pascua, and these are the parts which are talking back and forth here. Pascua, you've been going to church all this time. You really believe in that stuff? Really? Do you believe in that stuff? Now that you've got to examine yourself, do you believe in that? And a part of me was having a conversation with that part going, look, out of all the things that I could remember at this point in time, at this moment, I'm remembering a phrase from the chorus from an Easter song, be not afraid? I guess so. Yes, I guess so. And at that point, the epiphany occurred. Suddenly, I was not within the darkness and fear. I was next to it. And I was looking at this thing, and I'm thinking, and I move away from it, and it follows me, but it does not engulf me. And I move, and it does not engulf me. And it was just the phrase, be not afraid. But okay, I'm just going to sit here until this thing stops, and I'm just going to wait until this thing kind of goes away. But I do not have to enter that fear again. That's optional now. I'm just going to sit here and be not afraid, be not afraid. But that is the epiphany that it can occur at the deepest part of the fear. And those words, be not afraid, followed me like ducklings until I opened my eyes and I found myself washed ashore on the shores of recovery in my hospital bed ICU recovery room. Next slide, please. Number 9. Be one's golden bough in the underworld. This is important because you'll be on your own until you come out of it. And until then, you must remember that you are there with your own best friend, and that is you. Okay, next slide. From NERVAL. Again, being poetically cogent, even in the midst of serious mental turbulence. Anchor yourself, maintain your self-identity when all else is undefinable. You will not forget who you are. Number 7, Baudelaire. Allow hallucinated vision as fodder for creativeness. Let's talk about hallucinations for a while. Now, all of you are sitting in a chair, I think. How do you know you are sitting down? You can close your eyes, and how do you know you're sitting down? Well, that's because you can feel the chair, on you. Now, let's say that you are lying down and you are looking up at a ceiling fan. Okay, you're lying down, you're looking up at a ceiling fan. How do you know you're lying down? Because you can feel proprioception. You can feel that you're lying down and therefore the ceiling fan is above you. Now, let's say you're fully anesthetized, okay, not sedated, but anesthetized. And you kind of look up a little bit and you see this spinning object that's there. You know it's in front of you, but you can't feel anything. So it could be a ceiling fan on top of you coming down, or maybe you're sitting up and it's a propeller in front of you, or maybe you are facing down and looking at a propeller which is below you. Okay, so what are you going to do with that? First thing, you notice that you're not feeling hurt, and now you have to exercise some sort of creativity thought process in that. You need to keep your mind conditioned for that. So use it to keep your mind conditioned. Next slide, number 6, Valerie. Combine power with precision while engaging and allowing the gift of the mind to augment itself, to have an acute consciousness of one's own consciousness. Okay, you are thinking about thinking. Okay, maintaining objectivity is the only way to get through. Okay, next slide. O'Connor. Again, master even the grotesque, the fantastic, the ludicrous, and the bizarre. We are by distortion. We are surrounded by distortion right now. Okay, so we need to try and master it to keep our minds together. What is ludicrous? What is somewhat fantastic? What is ludicrous is that basically the entire world is walking around like this. Okay, so we need to master it. And how are we mastering it? Very good. We're designing our masks. That's good. That is our way of mastering that which would otherwise intimidate us and maybe even frighten us. Number 4. Next slide. Be a genius of consciousness, fully aware of everything, both concrete and, I mentioned before, spiritual, especially the spiritual. Since the latter, which is spiritual, which assesses and assures, and that it stabilized and assured me, deserves just as much attention as the former, which threatens to overwhelm. Okay, so be everywhere. The concrete is at this point attempting to threaten and overwhelm, and even kind of frighten us a little bit. What concrete things do we know? We know that COVID's around. We know that it may combine with the flu, and then if people are not getting their immunizations, it may combine with, another childhood outbreak. The last thing that we need is measles plus flu plus COVID all at the same time. Okay, those are the realities and the concrete things that we experience, and they're somewhat destabilizing. So we need to focus on spiritual stability. Number 3. Next slide. Almost there. Browning. Again, be undaunted by, and even to be in control of, if it arises, grotesquerie. Grotesquerie is a recurrent common theme that I'm talking about here. Luckily, we've learned how to learn each other how to cope with it. What is the most grotesque thing that's happening right now? Imagine a bird that cannot fly. Imagine a dog that is not supersensory. What about a horse that cannot run? There is something unusual and sad about that. But imagine human beings whose mammalian survival is built on the ability to socialize and communicate. And now we're told, can't get together, and we've got to keep more than 6 feet apart. After a while, it starts to work on the psyche. And we've been trying to do this for 6 months now. And I don't know if the end looks like it's in sight soon. Number 2, next slide, almost there. Okay, be comfortable in a cosmos of eccentricity, populated by eccentrics, because unfamiliarity, unpredictably can make you uncomfortable and then fearful. And that's the other thing that people have heard me say time and time again. Do not be afraid of COVID. What? After all you've been through? Yes, do not be afraid of COVID, but respect it. Respect it in the same way that we respect the ocean. We do not fear the ocean. We've learned how to respect it. We've learned how to mask ourselves up before we go into the ocean, right? We learn how to do these things. So now we have to make sure that we do these things too. Because COVID is like the ocean, but without any upside to it. And now we are almost like up to our nose in COVID. Okay. So last line. Ellison. Constantly be aware in infinite possibilities. This is the most helpful for you in when things get down deep. Because when things are at its worst, remember that there is another you someplace else. It's almost metaphysical. You are there with your loved one in a place of comfort, and that there are people literally pulling for you in the here and now. So that last part is important, because looking back in retrospect, so who was there helping through all this? There was the doctors and the nurses, and there was my family and all that. They were hoping. But after coming out the other end, this is what happened, is I was falling headfirst like a rag doll into the COVID vortex. And there were individuals who became aware of that in one way or another. And their well wishes and their prayers and their positive good vibes just went out, grabbed me by the ankles, and just pulled as a collective. They just pulled and just pulled until I was out of that COVID vortex. And there I was, out of breath, 25 pounds lighter, losing 25 pounds in 10 days. Couldn't even lift myself against gravity. But there I was going, wow, what a trip. My goodness. And then I find out all the people that had been wishing well for me from so far away. One of them was Dr. Claire Wilson, who trained me as a pediatric resident. She was a gastroenterologist. I haven't seen her in, I don't know how long, and it must be like at least 15 years. And now I get a letter from her from Alaska saying that she heard about what happened. And now these people just pull. They're just pulling me. And then I look up, and all those individuals who gave me their well wishes, I look around in this beach that I wash up on, and they're all gone. All gone. So anyway, thank you for your time. Next slide, please. Thank you for your time. And again, be not afraid. Thank you for your time. I will take questions.
Dr. Pascua, thank you so much for sharing your own personal story and your family's story. It certainly is extremely powerful. For the audience, please remember to type your questions into the chat box, and I will read them out loud for Dr. Pascua to answer. Dr. Pascua, I just have a quick question for you.
Yes.
What's the rest of your family doing?
Very good. Yeah, they're doing very well. I would say that COVID-wise, they're doing quite well. My son, he had lost his sense of taste for a while, but then he got that back, a little bit of upper respiratory symptoms. But otherwise, that's the only thing that happened. With regard to what happened to my family, I'll go a little bit further from there. I remember the first time that I FaceTimed my family. And they were around the dinner table kind of FaceTiming. And I remember kind of sitting there in my haze, and I still got oxygen in there. And I'm saying, hey, hi, how is everybody? And they're looking at me going, oh, okay, Dad, we're good. And meanwhile, I'm looking around, and then I turn to my son. It's my son's turn to talk. I go, hey, Christopher, how you doing? And he goes, I'm doing well. And then I heard his voice crack. And I realized that out of everybody in the family, he took it the hardest. And as I talked to him later, I realized, why did that happen? It's because, he said, well, Dad, you can talk to Mom, and Nikki, she can talk to her fiance, but he was kind of by himself, trying to process this through by himself. And then I remember on the first day that I was kind of back home, and again, I was too weak to even lift up a bar of soap. I remember the next morning, he comes bursting out of his room, and he's in tears. And I go, Christopher, what happened? Now, again, my son's 20 years old, I go, Christopher, what happened? And he looks at me, and he's sobbing, and he's going, Dad. And I say, come here, son. And, I have him just lie down with me, and I'm holding it, I'm hugging him, going, what happened? he goes, Dad, I had a terrible dream. I had a terrible dream. I dreamt that you and me got into some sort of argument and you had to go back to the hospital. And he's sobbing and sobbing. And I said, Christopher, and I'm holding him. I said, Christopher, all that, it didn't happen. What you're afraid of, it did not happen. Okay? Now we got a question here. Did the hospital staff attempt to reassure you along the way? It's important for us to remember to do. Oh, yes. So I can tell you what kind of interactions I had with the hospital staff while I recall kind of being intubated and ventilated. Okay? And this is what impressed me the most. So at one point, again, you lose your sense of balance and orientation. Now imagine that you were lying down, okay? You were lying down, you're like this, okay? And the nurses are walking around you, okay? The nurses are standing up and they're walking around you while you're lying down, okay? So imagine now that you're gonna keep this orientation. See, here's a nurse over here. Now imagine that you think that you're standing up, or that you're like this. And what you're actually witnessing are the nurses moving alongside of you and under you like this. It's like they're fish that are swimming underneath you and on either side of you. That can be very, very freaky, you know, and you're wondering, who are these individuals? And you hear some voices, okay? And I remember from that position, feeling the restraint. I remember trying to get up, but feeling like I couldn't. And I just kind of remember this glowing line coming from my left arm and kind of coming out. I don't know if you guys can see this, coming from my left arm, coming up this way, glowing line, okay? In retrospect, I'm thinking, was that my IV line? You know, but then now I'm looking ahead and there are these voices which are around there that seem to be coming on the other side of this wall, but in fact, I'm staring at the ceiling. It's very disorienting. And I just felt like I needed to get up so that I could interact with these people. And I heard a voice. What are you doing? What are you doing? Look, you know, now we've got to put you back, you know, in a comfortable position. You're starting to kind of fall off the bed over here. Okay, relax. And I'm hearing this voice, you know, I'm going, who is this? You know, but you can't say anything. And all I'm thinking is that this is unfamiliar. I don't like to do this. Okay. So I think that, you know, if I heard a voice coming into my left ear, and the voice is kind of saying like, hey, Dr. Pascua, this is your nurse. You're intubated and you're restrained, but you're doing fine. You're obviously active. And I know you don't like being where you are, but be patient and we're going to help you out as much as we can. Okay? Okay? Okay. Now, I turned off the sound because that is what it would have been like for me. But to just hear that voice would help quite a lot. Or something like, hey, we just finished calling your wife and she said hello. I remember my daughter wanting to call the ICU to say, hey, can you guys play some music in there for my dad? You know, he likes hip hop and R&B, so maybe you guys can kind of play that. And I'm thinking, okay, all right, maybe that would have been nice too, right? So I think for the intubated and ventilated patient, when you look, I mean, you see their heart rate climbing and you see them maybe fighting the vent a little bit, they can hear you. They may not be able to acknowledge, but they can hear you.
Thank you, Dr. Pascua. That's a very important thing for us to all remember as we are taking care of our patients, that they can hear even when we think they cannot, and even one little kind word can make a big difference in someone's life. The question here
Yes.
from Uemura, he said, thank you for sharing your story. He works as a palliative care physician. We sometimes say intubation and being on the vent is suffering and recommend families to discontinue the ventilator when there is only a slim hope. Do you feel that you were suffering while you were on the vent?
Okay, good question. Physical suffering from pain, difficulty breathing? No. Fully anesthetized, feeling no pain, okay? But what part happens with the suffering? There is the emotional part of it. Because a person is fearful. and they do not forget. They are not forgetting that there's a family that's waiting for them, that there is that there's a family waiting for them, there's a job waiting for them, there's a spouse that's waiting for them. They're able to remember that during the times when they are lucid. So recommending families to discontinue the ventilator when there is only a slim hope. This is so, I mean, it's impossible to assess the amount of hope that the intubated patient is feeling. I mean, how does that happen? How do we communicate with the intubated patient? I don't know. I don't know. Is the intubated person feeling hopeful? At some point, as an intubated patient, I was feeling mad. I was feeling hopeful. I was feeling scared. I was feeling, what's this going to do to me? At what point do I summon my family back and say goodbye? But meanwhile, I'm doing all of this. I'm trying to think my way through using those 19 points that are there. So I would say that there was some emotional suffering that was there, but physically suffering, person doesn't really feel anything unless they try and fight the restraint. Then they feel their immobility.
Dr. Pascua, what do you tell your patients about, preventive measures, wearing masks and distancing? Because we see here in Hawaii, there are many people who don't, and even on the we see it on TV.
Yes.
We're not listening to recommendations. What would you say to them?
And that is human nature. It's human nature. There's nothing, I don't think there's anything to be gained by going to somebody and saying, hey, put on your mask and all this, and kind of getting to them and debating them in public. I don't know if that's going to help or not. I think that, people will do kind of what they need to do and will remember things conveniently as much as possible. I mean, going to Costco and you see everybody wearing masks, but I mean, how do you physically keep apart from people on a Costco on a Sunday afternoon? I mean, and people just want to, try and get together. What I tell people is that there are three things that need to happen before we kind of get back to normal. Number one is already happening. The immune systems are adjusting and your body is trying to deal with this. Maybe making antibodies, but we're figuring that out. Smart people are figuring this out. Number two, then the second thing is that we don't have a vaccine yet. We need this, but we don't have one yet. But there's smart people working on this. The other thing is that we have no medicine against COVID to take, but not yet. Some smart people working on this too. So we got three things over here which are working in our favor. That's awesome, awesome, awesome. That's a reason to sleep well at night. But there's one thing that's working opposite of it, and that is we are an impatient species. Okay, people are they're not wearing their masks or whatever. It's because part of us we're impatient. Okay, let's just get past the mask wearing part and let's just get back. Let's go to the normal part already. Can we just skip this part of the movie? And at some point they understand, no, we are not skipping this part of the movie. Okay, until we apply enough pressure to make this cognitive thing go away, then no, it's going to be with us for a while. And it requires a zero tolerance for COVID for everybody personally.
Thank you very much, Dr. Pascua. Does the audience have any other questions to ask? Give it another few seconds while you can type in the chat box. Everyone, please don't forget to turn in your evaluations. I think Michaela put the link into the chat box, and also you can get it from our website or from the invitation. There's a link to the evaluation from the invitation email as well.
Part of also the function of this talk, I guess, the target that I'm saying is, this is something that I was discussing with a media person, is that everything that we're saying in the media right now is prevention. I mean, it's prevention. So if we do certain things, we will keep ourselves from having COVID. And that is absolutely true. Okay. But now what we have to do is we have to kind of go one step further, and that's to get to preparedness. So that's what this whole thing was all about today. It was not so much about COVID prevention. We know all about that, washing hands and all that. But now we come down to COVID preparedness. What do you do if it actually engulfs you or apprehends you? Again, having gone through this before, those are the things that I would have you pack in your cognitive glove compartment should you find yourself going through a journey you don't want to go through.
Thank you very much, Dr. Pascua. We really appreciate you sharing your wisdom and your experiences with us. All our wishes to you and your family. And again, thank you. Thank you, everyone, for joining us for today's Grand Rounds.